Hey everyone! Did you know that 1 in every 8 women will face breast cancer at some point in their lives? It's a scary number. But there's a good news. It is found early, it's very treatable. So in this video, we're going to break it down. Everything you need to know about breast cancer. What it is, and how it can be treated, in the simplest way possible. If you care about your health or someone you love, make sure to hit the subscribe button, and let's dive in. Alright, let's start from the very beginning. What actually is breast cancer? Our body is made up trillion of tiny cells. These cells have a perfect system. They grow, divide when needed, and then die when their job is done. But sometimes, a few cells stop following the rules. They start growing uncontrollably, like someone forgot to hit the stop button. When that happens inside the breast, it's called breast cancer. Now, not every lump in the breast means cancer. Sometimes it's just a harmless growth. But in breast cancer, those abnormal cells don't die when they should. Instead, they keep multiplying and form a mass or tumor. If that tumor stays in one spot, doctors call it benign, which means it's not dangerous. But if those cells start invading nearby tissues or spreading through the blood or lymph system, that's when it becomes malignant. And that's what we call cancer. Think of it like this. Your body is a well-organized city. Every cell is like a citizen with a specific job. Cancer cells, they are the ones who stop following the law. They grow, spread, and mess things up around them. Breast cancer usually begins in one of two places. The milk ducts, which carry milk to the nipple, or the lobules, which are the glands that actually produce milk. And that's why you might sometimes hear terms like ductal carcinoma or lobular carcinoma. They just describe where in the breast the cancer started. Another thing, breast cancer doesn't happen overnight. It develops slowly, often over years, and in the early stages, you might not feel any pain or notice any change at all. This is why regular checkups and self-exams are so important. They help catch it before it grows or spreads. So in simple words, breast cancer is when some breast cells go wrong, start multiplying too fast from a lump, and may spread to another parts of the body if not treated early. So now that we know what breast cancer is, let's talk about the different types. Because not all breast cancer are the same. You can think of it like this. Breast cancer is like a family name. And under that family, there are different members. Some are more aggressive, some grow slowly, and each one needs a slightly different treatment. Ductal carcinoma. This is the most common type. It starts in the milk ducts, the tiny tubes that carry milk from the glands to the nipple. Now there are two main kinds of ductal carcinoma. Ductal carcinoma in situ, invasive ductal carcinoma. DCIS, this means the cancer cells are still inside the ducts. They haven't spread out yet. In situ literally means in its place. It's an early form of cancer and often curable if treated early. Invasive ductal carcinoma. This one is more serious. The cancer cells have broken out of the duct and started invading nearby breast tissue. This is the type doctors see more when diagnosing breast cancer. You can imagine like this. In ductal carcinoma in situ, is like fire starting inside a closed room, while invasive ductal carcinoma is when that fire breaks through the door and starts spreading to the rest of the house. Lobular carcinoma. This type begins in the lobules, which are the small glands that actually produce milk. Just like before, it can be lobular carcinoma in situ and invasive lobular carcinoma. In situ, it's not a true cancer yet, but it shows abnormal cells inside the lobules. It's more like a warning sign. It means there's a higher risk of developing breast cancer later. In invasive lobular carcinoma, this one spreads beyond the lobules into surrounding breast tissue. It can be a bit tricky to detect on a mammogram because it doesn't always form a clear lump. Sometimes it just makes the breast feel thicker or different in texture. There are also some rare types like inflammatory breast cancer, which causes redness and swelling inside of the lump. Page's disease, which affects the skin around the nipples. Triple negative breast cancer, which doesn't respond to hormones and can grow faster. but it's often treatable with chemotherapy. These are less common, but doctors take them very seriously because they tend to act differently from the usual types. Alright, now let's clear up one of the biggest myths about breast cancer. Some people think it's a woman-only disease, but the truth is, men can get breast cancer too. I know it sounds surprising, because we usually connect the word breast with women, but actually, both men and women have breast tissue. It's just that women have more of it. Let's start with women first. In women, breast tissue is larger and more developed because of hormones like estrogen and progesterone. These hormones play a big role in how the breast grows and changes, but they can also affect the way breast cells divide. So when these hormones are unbalanced or when something goes wrong inside the cell, it can trigger abnormal growth, which can eventually lead to cancer. That's why breast cancer is much more common in women. In fact, around 1 in 8 women will be diagnosed with breast cancer at some point in their lives. Women also experience natural hormone changes during menstruation, pregnancy, breastfeeding, and menopause. And all these shifts can slightly influence breast tissue and risk levels. Now, let's talk about men. Even though men don't have large breasts, they still have a small amount of breast tissue right behind the nipple. And because that tissue also has ducts and cells, it's possible for those cells to become cancerous too. But there's a difference. Men don't have high level of estrogen, so their risk is much lower, about 1 in 800 over a lifetime. However, when it does happen in men, it's often diagnosed later, because most men never imagine it could happen to them. So by the time they see a doctor, the cancer might have already spread. That's why awareness is so important. Men should also check for unusual lumps, nipple, discharge, or changes around the chest area. Women are at much higher risk because of their hormones and large breast tissue. Men have a much lower risk, but when it happens, it's usually found later. And that's what makes it dangerous. So whether you're a woman or a man, don't ignore any change in your chest area, even if it feels small or weird. A quick check could make a huge difference. Awareness literally saves lives. Now here's one of the biggest questions people always ask. What actually causes breast cancer? And the honest answer is, there isn't just one single reason. It's not like catching a cold or getting food poisoning. It's usually a mix of different factors, your genes, your hormones, your lifestyle, and sometimes just a plain chance. Let's break it down together. Some people are born with a higher risk. If your mother, sister, or daughter had a breast cancer, especially at a young age, it means there might be a genetic mutation running in a family. The two most famous ones are called BRCA1 and BRCA2 gene. When they work normally, they protect you. They help repair damaged DNA. But if those genes are mutated, that protection system doesn't work well anymore. So the body can't fix damaged cells probably. And that can lead to cancer over time. So yeah, family history matters, but it's not everything. Most people who get breast cancer don't have a family member with it. Another big factor is age. The risk of breast cancer increases as we get older. Most cases happens after age 40 or 50. That's because the longer our cells live, the more chance there are for little mistakes to happen during cell division. And sometimes one of those mistakes turn into cancer. Hormones play a huge role, especially estrogen. This hormone helps breast cells grow and function, which is great. But if the body has too much estrogen for too long, for example, yearly puberty, late menopause, or hormone therapy after menopause, those cells are constantly being told to grow, and that increases the risk of mutation. Now let's talk about the part we actually can control, our lifestyle. Things like being overweight or obese, especially after menopause, drinking too much alcohol, smoking, not being physically active, eating a diet high in processed foods and sugar. All of these things can affect hormone levels, inflammation, and overall cell health. And here's something many people don't realize. Even chronic stress can play a small role because stress hormones can mess with your body immune and repair systems. So while stress alone doesn't cause cancer, it can make the body less balanced, and that's never a good thing when it comes to long-term health. Some chemicals in environment like radiation or long-term exposure to toxin can also damage DNA inside cell. That's why people who work with certain industrial materials or have had chest radiation for other medical reasons might have a slightly higher risk. But remember, having one or even several of these risk factors does not mean you will get breast cancer. It just means your chances are higher. So it's important to be aware and take care. So breast cancer doesn't just come from one cause. It's like a puzzle. A few pieces might come from your family, a few from your lifestyle, and sometimes one piece is just random. But the good news is we can control some of those pieces. We can eat better, move more, and do regular checkups. That's real prevention. So the key message is this: check yourself regularly, don't ignore changes. Breast cancer isn't always preventable, but early detection can make all the difference. If you found this video helpful, please give it a like, subscribe, and share it with someone who might need to hear this.